This call is being
telling
This call
our
is being recorded.
businesses, for good reasons in many cases, right? Concern over spreading the disease, trying to flatten the curve, to shut down or at least do a 15-day slowdown. But that is a extinction level event for a lot of our small businesses and our medium-sized businesses. So the question is, how can we mitigate the negative economic externalities of that slowdown while not inducing a broader recession that would do a lot of harm to our economy in Wisconsin and nationally, and while also doing what we need to do to make sure that the hospital systems in Northeast Wisconsin don't get overloaded. I am not going to lie to you and tell you that there is an easy solution to that problem. Inevitably, any path forward involves very painful trade-offs, but it's going to be something that we not only have to figure out from the federal level, but from the bottom up in every community, in every county, in every city, and every district in the country, because certain things may work in New York, they may work less well in Appleton or Brilliant. So I just throw that out there as kind of the lens through which I'm viewing this. I would say the reason that the entire Wisconsin delegation voted against the initial bill that went through on Friday, and I don't speak for them, I can only speak for myself, but I think this is where most people are at, is that if we're asking our small businesses and our medium businesses, which is where most people, with the backbone of our economy, if we're asking them to pay the price here by shutting down, they are indeed entitled to relief from the government. The Fifth Amendment, the takings clause, says if the government basically does eminent domain, you have to be compensated in a justifiable way. On board. But the mechanism that they proposed to do this in a bill that no one saw was to require those very same businesses between 25 or 50 employers to 500, exempting all of the big businesses, 500 more, requiring them to pay sick leave combined with expanded FMLA leave, totaling up to 12 weeks potentially of leave. Now, the idea is to allow people to stay home if they're sick, and we don't want any employee to have to choose between, getting that paycheck they need to survive and going to work sick and potentially infecting other people. But the problem, as I see it, is by asking our small businesses to pay the price of that based on a promise of the federal government later on via a complicated tax credit, making them whole. Well, that's not quick enough. Some people don't have enough cash on hand, and I'd really be curious to hear from people on this call. Some people just don't have enough cash on hand to last a week, let alone 2 weeks. And also, they may have to, as we're already seeing in Wisconsin, proactively close down their business, fire a bunch of employees. There's not going to be anyone to pay those employees that we're trying to help. Now, I will say there was a technical corrections bill that was passed on Monday by unanimous consent that went through the Senate, which I think made the bill better. I don't want to talk too much, but let me give you my rundown of this bill as I understand it, and then we can talk about, if you want to, the broader stimulus bill that is being debated in the Senate right now, although I just don't know. McConnell released something last night. We don't know where that stands or if and when they're going to pass it. But essentially, the bill that's been passed now requires private sector employers with less than 500 employees and government employers provide employees that have been on the payroll for at least 30 days with up to 12 weeks of job-protected leave under the Family and Medical Leave Act, if that employee is unable to work due to a need to care for their minor child because of the child's school or place of care is closed, or if the child's child care provider is unavailable due to the coronavirus. So this is one of the good things that was changed. The bill was narrowed to focus on people who are impacted because they have to care for their child. And additionally, we exempted, which the original bill didn't, we exempted some of our first responders, our sheriffs, our cops, as well as our healthcare providers, which we need on the front line. So how does the leave work? Well, the first 10 days are unpaid. The employee can decide to substitute any accrued vacation leave, personal leave, or medical sick leave during this period. Employers cannot require an employee to do so. Then the remaining 10 weeks, again, for about 12 weeks total, of emergency paid leave are paid, and the employer is required to pay the employee at a rate no less than 2/3 of the employee's regular rate. That's up to a maximum of $200 a day and $10,000 in the aggregate. So the intent, at least, is to give people up to $10,000 in 12 weeks in order to shelter in place and stay home and isolate if indeed they are sick and or they have to care for a child. So FMLA is job protected leave, meaning employees must be restored to their prior position after taking such leave. Now, here's another critical piece. Employers with fewer than 25 employees may be exempt from this position, if the position no longer exists due to operational changes caused by the public health emergency. Though there are conditions that must be met. So the only people that might potentially get relief from this are if you have 25 employees or less and you've had to shut down because of the emergency. If you have 50 or fewer employees, you're not subject to FMLA damages if an employee tries to sue you for having to let people go. Just quickly, and I promise not to talk too much because this bill is very complicated, and honestly, I spent 2 hours on the phone with the quote-unquote experts at the Congressional Research Service, and even they were struggling to understand how it actually works in practice because so much of this was based on the promise that the Treasury Department would fix it via regulation later on, and Secretary Mnuchin has yet to come out with the regulations necessary to figure this thing out. But in addition to expanding paid family leave, the bill also requires employers to provide paid sick leave. Covered employers must provide 80 hours of paid sick leave, sick time to full-time employees, and a prorated amount to part-time employees that are unable to work or telework due to a need to leave for the following reasons. First, if the employee is subject to federal, state, or local quarantine or isolation related to COVID-19. Second, if the employee has been advised by a healthcare provider to self-quarantine due to COVID-19. Third, if the employee is experiencing COVID-19 symptoms and is seeking medical diagnosis. And four, if the employee is caring for a person who is subject to a COVID-19 related quarantine or isolation order. Fifth, the employee is caring for his or her minor child due to the child's school or place of care having been closed, or child care and the things I talked about before. And then finally, if the employee is experiencing any other substantially similar conditions, and HHS gets to specify what that looks like. The sick leave, and it's the final thing I'd say, and I'll just then have a few brief comments, big picture. The bill limits paid sick leave to $511 per day and $5,110 in the aggregate. If the leave is taken because the employee is quarantined, and if the leave is taken because the employee is quarantined or experiencing symptoms of the virus and seeking a medical diagnosis, and $200 per day if the leave is taken to care for another person that's quarantined or for your child. So very complicated provisions that were passed in a hasty fashion. I will say, though, I voted against it because I think it might put more of a burden on precisely the types of people that are on this call. We did work to try and fix some things in the bill, some things I mentioned. It's fair to say it got better, though not perfect, by the time it went over to the Senate. Now the Senate is considering a broader, potentially $1 trillion stimulus bill. While I don't know what that final product is going to look like, I can tell you my broad perspective on this whole thing, and then I would love to hear from you guys directly as to what you are seeing and hearing. One, I think we have to prioritize right now, and our priority should be on doing everything we need to defeat the disease. And my view is the quicker we get the disease under control and make sure our healthcare system is equipped to deal with even the worst case assessments. And part of that is us acting responsibly as citizens and doing social distancing. But the quicker we do that, the quicker our economy will be able to recover. And so to the extent we're thinking about cutting a $1 trillion check, we have an obligation now that we've forced, the federal government and state governments forced businesses to shut down to make those people whole again. They've taken essentially your property away from you and you need to be compensated for them. But we need to prioritize resources to the healthcare crisis, and that will in turn alleviate the economic crisis. There are some things, though, that we should be looking at based on the lessons we learned in terms of what we did right and what we did wrong during the 2008 crisis that would help places like Northeast Wisconsin and not just help places like New York and California. In particular, our small banks and our medium-sized banks in Northeast Wisconsin are going to be the ones who are under a lot of pressure. And I'm sure they're getting a lot of calls from the businesses they support, probably from a lot of just individual depositors who are thinking, well, maybe I should move my cash from Nicolay to Chase, because I know the federal government's always going to take care of the big banks, but they're going to forget about the small guys. That's a valid concern. And so one thing we did successfully in the last crisis was to extend unlimited transaction and deposit insurance from the FDIC to basically send the message that your money is safe in a bank and allow our small and medium-sized banks to do what they need to do. So I'm not saying no intervention is necessary. I just think the right type of intervention is warranted. And then finally, I just would say all of this is bound up in this bigger and difficult question that we're going to have to really debate and resolve in the next 48 hours, which is to say how we've seen, we're 7 days into this 15-day slowdown. We are seeing the cost that it is exacting on Northeast Wisconsin. And while we understand the very real risks of allowing COVID-19, coronavirus to spread, we also need to balance that against the fact that Wisconsin needs to work, and we do not want to induce a prolonged recession. And we certainly want to ensure that anything we do doesn't cause more damage, not just economic, but physical, mental, emotional, and otherwise, via an ill-considered intervention. And that's a question that, quite frankly, I could use your help in working through, because there has got to be a way where we do what we need to do to isolate the vulnerable population, while at the same time ensuring that we do not proactively destroy our own economy and, by extension, our community in Wisconsin. There's got to be a way where we have enough faith and trust in our citizens and our businesses to say, figure out what social distancing means within the context of your specific company, right? Because neither the governor nor the president nor any individual congressman can design a one-size-fits-all solution for that problem. And the idea that we're all going to sit in our homes for a month is going to come with enormous costs. So I'm laying my thought process bare for you right now, and happy to answer any questions you have. If in any case I don't have the answer to it, I will work to get one. We are working 24/7. My staff is largely doing telework, but we are still on duty and doing constituent services. So, Jamie, I think we have questions that were submitted before. Is that correct? And I can go into those if that's what you want to do.
Yeah. We have some questions that were submitted before, and then I do have a few that have been submitted since I was able to send them over to you. So if you want to start,
perfect.
Go ahead.
Perfect. Well, so there was a sum of questions that were asked repeatedly. So I'm going to prioritize the two questions that were asked the most. Which the first one seemed to be whether or not legislation could be passed to require insurance companies to treat this pandemic as a covered condition under business disruption insurance. So I would say that protecting small business is a top concern, and all options are on the table, whether that's through business disruption insurance or another mechanism. I think what you're seeing right now is a bipartisan commitment to getting small business the aid they need quickly and efficiently, particularly if they're the ones we just asked in this other legislation to bear the brunt. My team has already drafted that in terms of a potential amendment that we're trying to work with senators to get included in whatever passes the Senate. And then certainly if we get a bite at the apple in the House, we will try and do that. I just would say that in the House, as we saw last time, there's a high probability that they won't allow any amendments, which is a shame and unconscionable in many ways, but just the way they're running this process right now. So that was one question we got a lot. And if you have further ideas related to that, particularly on how we make sure small business doesn't suffer or bear most of the costs while we consider bailing out big businesses, we are in the market for those, and we are actively trying to shape whatever the next legislation is coming through in that direction. The second question we got from a lot of people was whether Wisconsin would mandate that all non-essential companies would close and what would be defined as non-essential. I just would tell you that my phone's been blowing up for the last 48 hours from all sorts of different industries that believe they are essential. It is very difficult to define non-essential and essential, right? Because even, there are some obvious things that are essential. Hospitals, our grid is essential, our water supply is essential, but even those industries I just named rely upon vendors to keep their IT systems running. You can make an argument that Camera Corner in Green Bay is essential because they're servicing hospitals, they're servicing the police department, they're servicing our local firefighters. It's quickly very difficult to make an arbitrary distinction between essential and non-essential. And that is part of the broader dilemma I laid out. I would say if I can make an optimistic assessment for where we can go, and if I were king for a day, this is at least what I would be planning for and what I've talked to the governor's team about planning for. What I think gives us the best chance to thread this needle between slowing the spread of the virus without committing economic suicide. I would say we grit our teeth, we get through this 15 days to slow the spread, and we make sure that we make whole anybody that we force to shut down for that period. We then figure out what a risk-based approach after that 15 days looks like, assuming we've gotten our testing systems online and we have a way to go there. And I'm happy to talk about the medical side of this, which I've been more immersed in. We could then move to a posture where if you are not in the vulnerable population, let's say you're 50 years old or below, you don't have a pre-existing condition, you're not symptomatic, you're not feeling sick, you can work provided your company is doing responsible social distancing. And again, a lot of this, I think, is going to be us telling our companies, we trust you to make responsible decisions for your employees, whom you care about a lot more than the government ever will. We need you to work, right? We're still going to isolate those who are symptomatic. We're going to isolate those who are most vulnerable. We're going to ramp up our testing capacity. We're going to ramp up our supply of PPE, of ventilators, all the things the hospitals need. We're going to prepare for the worst while we hope for the best, but we're going to keep our economy moving. And then you don't have to get into this almost impossible decision of essential versus non-essential. I would rather have the companies define themselves which employees are essential and which employees are non-essential, or rather which employees can afford to telework and which employees can't telework. And for those that can't, let's say you're working in a factory, how do you creatively come up with shifts that still allow you to avoid crowds of 10 or more, do social distancing while keeping the factory running? I think that would be a much smarter approach post 15 days, because as I suspect, or what I'd like to hear from most of you, if we're talking about another 15 days, well, then we're in a heck of a bind at that point. I just don't think we can afford to shut down for 15 more days. That's just my sense. That's what I've been getting in the last 72 hours from people, and I get that it's a terrible dilemma. I had a question from Ann, who works at home. Are large retail stores, Walmart, Home Depot, supposed to be shut down as well? Fortunately, despite shortages we've seen in the healthcare sector, most of our national supply chains have actually held up pretty well. We're blessed to live in a country that can feed itself in particular, and we're still transporting food to our shelves, even in the midst of a crisis. If you've been to the grocery store, unless you went to Costco at the wrong time or Woodman's at the wrong time, you've by and large been able to get what you need. And for those of you who are hoarding toilet paper and water, I would just encourage you not to. There's no threat to the water supply, even in the worst case scenario. While everyone needs to be smart about when they go out to buy groceries and other essentials, we can't afford to shut down the entire economy, as I said. And so right now, I don't know of any plans to shut those down. I think in any scenario, at least the grocery stores would be kept open. We need to take precautions for senior citizens and others who are at high risk only during store hours. I think it was Festival who sort of set aside their early morning hours going to be for senior citizens only. And that's an example of a creative way where our businesses are finding out solutions to this themselves. And ultimately, I think that's what this is going to look like. Again, we're going to have to trust Wisconsinites and Wisconsin businesses to figure this out in a way that makes sense for their population, right? Because, Appleton's different from Green Bay is different from Brillion, Brilliant's different than Marinette, et cetera, et cetera. Door County, they made us decide to pull the bridges up and tell visitors don't come. But so there's going to have to be a nuanced approach to this. But so far, I haven't heard that they're going to shut down retail stores. Retail stores have had to figure out how they're going to pay certain employees. And by the way, the message I've heard, and there may be some exceptions, to companies that can afford to take a 2-week pause, their first concern is paying their employees, taking care of their employees who are sick. If for no other reason than, well, they certainly care about them on a human level, but they don't want to lose these people. We all know, the biggest concern from every chamber that I heard prior to this was workforce. No one can afford to lose employees, and we need to have those people go back to work when we get through this crisis. A question from Sandra at St. Paul Elder Services. Sandra has a few questions, and in the interest of time, I wanted to get a few. She asked specifically and related to long-term care provisions. She asked, what is your office doing to get long-term care providers the emergency funding they need? Will you prioritize the elderly when it comes to economic relief? Will you prioritize long-term care providers over corporations in the travel industry in terms of economic relief? The short answer is yes. If I had a flaw, the primary flaw with the bill that's been passed now and the bill that I see coming through the Senate is it does seem to be prioritizing things like the cruise ship industry, the airline industry, and Wall Street and big corporations, as opposed to the people in our communities that need this help right now. Long-term care providers, if and when we get our testing mechanisms figured out, and we're making progress. I visited 2 mobile testing sites in Northeast Wisconsin yesterday, but there's some bottlenecks at the state labs we need to figure out. Our hospital workers and then our long-term care providers are the first population we need to test so that they can remain on the job doing what they need to do. I do think if we get out of the 15 days as well, even if in the most aggressive approach, economically speaking, we will have to continue to strictly prioritize protecting the elderly population because they are at most risk of the disease. And so there is going to be a period of time where we're asking our elderly population to shelter in place, and where we, not only those of us who work in government, but all of us who are just citizens of Northeast Wisconsin who may be in a less vulnerable population, have to figure out how we can get them the food and the care that they need. And I got to believe that we can figure that out. One small thing you can do that we did yesterday is if you are shopping, almost every, at least in my neck of the woods in Green Bay, if you go to almost any grocery store, you will have an option to buy a bag of groceries for Paul's Pantry and other organizations like that. And so that's just a small way where we can help out. And I would ask you to promote that on your social media forums and in your businesses and things like that. So we are going to have to prioritize the most vulnerable population That starts with the elderly, but it extends to those who are on the front lines, particularly our healthcare workers and our first responders right now. Because the sad reality is we are going to have a lot of ne'er-do-wells who try and take advantage of this crisis. I talked to all the sheriffs in the last 24 hours in our district. They're already having to prioritize certain things. There's a concern about how to maintain jails in times like this. We can't allow a breakdown in law and order during this crisis. And I think we have a strong enough community here where we won't have that, but it's just something to be on our mind. I had a question from Ted from Wisconsin Industrial Coatings. He asked me to explain how the tax credits will work to offset the costs of paying employees sick leave and FMLA without creating cash flow problems, and why the House bill only impacted businesses with 500 employees or less. On the second part of your question, Ted, why it only impacted businesses with 500 employees or less, I have no idea. I think it is one of the most egregious failings of the bill. Businesses that have over 500 employees probably have the cash flow necessary to handle this crisis, but instead we are placing the burden on our medium and smaller sized businesses. I think that's the wrong approach. Even the New York Times said there was a gaping loophole in the bill and criticized it for that very reason. I talked a little bit about the first part of your question at the outset, how tax credits will work to offset the costs of paying employees and sick leave, but I will concede that we haven't gotten an answer from Treasury about how the reimbursement and the tax credits will work. That was my biggest concern with the legislation. And just today, along with a number of my colleagues, I sent a letter to Secretary Mnuchin asking Treasury to immediately issue guidance in order to assist businesses with compliance and help them navigate the resources and options they have available to them under the law. I will say we just can't afford to wait for 2 weeks to have that guidance, and any credit would have to be immediately reimbursable, because businesses can't wait to file even till the end of the quarter, let alone into the next tax season, in order to see the benefit of the tax credit. Because if they have to pay their employees for the next 2 weeks and they're shut down, well, that's an extinction level event. So as soon as we get an answer from Secretary Mnuchin, I will send it to you. I will say Senator Johnson tried to fix this very issue in the Senate bill. I believe they did not allow him to submit the amendment, but it was something that we absolutely could have fixed, and now we are left trying to fix it through regulation. Lacey from Sunflower Spa. Lacey had a few important questions I want to get to. First, can we apply for the Small Business 2020 program? And if so, how? Well, earlier this week, the Wisconsin Economic Development Corporation announced the Small Business 2020 program to provide $5 million in funding grants, with $5 million funding via grants up to $20,000 to businesses with no more than 20 employees to cover rent and to meet their payroll expenses, including paid leave, including sick, family, and other leave related to the coronavirus. For more information on that, I'd encourage you to visit the WEDIC website. But she also had an important question on FMLA requirements. She wants to know if, one, FMLA will impact businesses if none of their employee family members test positive, and two, how will it impact their employment fund? So as I explained at the beginning of this, the technical corrections bill that passed on Monday changed the bill in order to focus all of the FMLA qualifications on coronavirus and family members who have kids that are home because of coronavirus shutdown. So while the updated text still provides for about 2 weeks of paid sick leave for individuals experiencing coronavirus themselves, the more extended FMLA benefits, which kick in after 10 days and could last up to 3 months, are only for parents who are home caring for their child who is either out of school due to illness or their school has closed down during the crisis. So let me say that again. The bill provides for 2 weeks of paid sick leave for individuals experiencing coronavirus themselves. If you're sick, maybe consult with the doctor. But then there is an extension of FMLA benefits, which kick in after 10 days and could last up to 3 months and are only for parents who are at home caring for their child who is either out of school due to illness or their school has closed down due to the crisis. So there's sort of two dimensions of this. One is for sickness related to coronavirus, and the other expansion of FMLA is for parents who have to deal with kids that are home from school because their kid is sick or the school has closed down. To my knowledge, this is the first time that the federal government via FMLA is requiring such paid leave in that way. The other thing I would say, just a quick side note on testing, for those of you who just may be concerned about, should I get tested? How do I get tested? I think there's been a lot of misinformation, some of it coming from the task force at the White House, some of it coming from the state, and some of it just coming from social media, which we should all consume less of. Testing, you shouldn't immediately go out to get tested. Even if you're symptomatic, the hospitals and the state health department want you to shelter in place, call your doctor, have a conversation about when you need to get tested. Because as we ramp up our testing, we need to ensure we're not clogging up the testing system. And we don't want a bunch of people, particularly those who have no symptoms, showing up at the hospital, demanding a test. And then if the hospital is not ready, that's going to create a cycle of fear and concern. So we have to be targeted in our testing right now. Just throw that out there. Another question from Aaron from Bear Performance Marketing. What needs to happen in order for a majority of people to be allowed to work again on site? Well, I kind of touched on this dilemma. This is the toughest decision. We need to balance economic crisis as more and more businesses are nearing the breaking point against the concern about overloading the public health system past its own breaking point. Now, I've spent a lot of time, I'm not a doctor, or at least a medical doctor. I've spent a lot of time talking to people in various businesses, and I do think we have to have a nuanced approach based on what business you are in, right? There are some businesses, even in construction, where if you're working outside, you're not in close contact with your coworkers, you should have the ability to continue working while we do targeted isolation going forward. But ultimately, that is going to be a policy that the governor comes out with, individual counties come out with in consultation with the governor. Potentially, there may be a decision to do a blanket national quarantine. As I've said, I think the best option going forward is to find a way to strike that balance where if you're not in the risk population, if you are healthy, and if you're at a point where your business can responsibly implement social distancing, we find a way to do that to keep our economy alive as we weather this storm. Next question from Thomas Nelson in Outagamie County. The state's GOP delegation was the only R or D delegation in the country that voted against the coronavirus bill. What is it that you figured out that 90% of the country's congressmen and women and senators got wrong? And do you agree with Senator Johnson that the bill will incentivize people not to work? Well, I just would say first, the bill that ultimately passed the House via UC was substantially different than the bill that passed on Friday night. So whether it will incentivize people not to work, we don't know. I think our concerns, as I detailed at the start of this call, were why are we putting the burden on small businesses and medium-sized businesses while exempting all of our big corporations and while not explaining to our small businesses how they can actually keep their people working and make sure they get paid and make sure that they don't proactively fire people or shut down and they can never recover. That question has yet to be answered, even by Secretary Mnuchin. I hope very much that it does. I hope that we are wrong. I hope that we won't have acted in a counterproductive fashion and place greater burden on our small businesses in Northeast Wisconsin. But it does seem there is a pattern where when DC acts very quickly, they seem to be listening only to the biggest actors and the lobbyists who throw a lot of money around. And certainly we don't want to arrive at a position where we are bailing out all the people with access to DC, and we are doing nothing to help our small businesses in Northeast Wisconsin, and nothing to help our families in Northeast Wisconsin that are getting hit by this. The next question is from Andrew from Vandahay Company. I have concerns about the gray areas in the Families First Coronavirus Response Act, as well as the time it will take small businesses to administer the process. Is there any way that this can be administered through the unemployment office or a government website of some sort? Small businesses have enough strain on them as it is, and we need to focus on the people on our teams and our customers. So kind of to tie this to the previous question, Andrew, you're getting at the heart of my concern, which is to say that any tax credit process administered via Treasury Department regulations or IRS regulations that haven't even been promulgated yet, and the bill's already been passed, is going to be too slow to help the businesses that are being forced to shut down by the government and then pay their employees when they're not able to work because their business is shut down. I actually think it would be smarter to get cash directly into the hands of those employers to give to their employees, or directly into the hands of the employees themselves, rather than forcing it to go through this filtered process of small business mandate, tax credit, that no one seems to know how it's going to work yet. Senator Johnson proposed an amendment that would have moved sick leave payments from small businesses to expanded state unemployment programs. I far prefer this approach, if for no other reason than these programs already exist, as opposed to a brand new tax credit that no one knows how it works. And it gets to that question of how do you get resources right now in a matter of days and hours, not months from now, because small businesses are already in a life or death fight due to the virus right now. Anything that doesn't emerge until the end of the quarter and certainly the end of the tax year is going to be too slow to make a difference right now. That ultimately did not pass in the Senate, so hopefully we can get something like that in the second stimulus bill, but we'll see. Christine, if I'm pronouncing that wrong, from Rooster Dreams Visual Arts, had a question. She expressed concern that we should prioritize financial help, not loans, in this crisis for small business, specifically sole proprietorships and service businesses, hair salons, massage therapists, art studios. I believe you have an art studio, Christine, that can't sell products through online sales, and wants to know if the government is looking specifically at these niche audiences that literally have no assistance or income. Well, Kristen, that's a great question. The economic impacts of coronavirus are going to be felt across the entire economy. No sector is going to be untouched, but there are some sectors like yours that are going to be more impacted than others. And so I think we have to look at providing support to industries that, A, the country cannot do without, and B, were especially or uniquely hard hit. I'll say it again. If we have a bailout of industries that aren't uniquely impacted by this, or for whom the stockholders took a risk when they invested in it, and we abandon our small guys and gals in Northeast Wisconsin, then that would be the wrong approach. But I will also say again, I do think the best thing we can do is to figure out a way to defeat this virus as quickly as possible so we can go back to work. Because I would suspect your business can't afford to spend another month in this current state. And the quicker we have testing, treatment, vaccines, and we equip our frontline people in the healthcare sector with the resources they need to prevent this thing from collapsing our system, the better off we will be economically. Rather than just admitting economic surrender and health surrender on the front end, we have to decisively defeat this disease. Question from Jay from Fox River Brewing. Jay had some really substantive questions on actions to consider looking into, such as, will the government end the 7-day waiting period in filing for unemployment? Can we put a moratorium on tax collection, sales tax, and property taxes? So I will say on the former, we need to get you an answer. I don't know right now if the government is ending the 7-day waiting period, But I do know that state decisions, as we're waiting state decisions, the federal government has pushed back tax day to July 15th, but Wisconsin's is still April 15th. I sent a letter to Secretary Mnuchin yesterday asking the federal government to move its deadlines back to July 15th and encourage the states to follow suit, and it looks like they have done that. But for unemployment and some other state tax decisions, we are awaiting whether the state is going to do that, and my hope is that they will, because we need to provide relief to people. Question from Nicole from Lucy's Closet. If businesses are forced to shut down, with exceptions of essential ones like grocery, pharmacy, etc., can pet stores that sell dog, cat food be considered essential as well? If they shut down, where will people get foods for their pets? Great question. That illustrates the unintended consequences of a draconian shutdown. Certainly, you could make an argument, and I think it gets to this broader issue I've talked about before about where is the line between essential and non-essential. I mean, you're not going to let people not feed their pets. You'll have people defying the orders of the state if we get to that point. It is a decision that's going to have to be made at the state level, but what I can reiterate is that our hope is that we'll have measures that have a balanced approach, that we're going to prevent a situation that forces us to close down all businesses outside of grocery stores and pharmacies. But ultimately, that's going to require all of us to act responsibly, right? If there's an immediate rush and people ignore social distancing and, people go back to business as usual, I mean, that can't happen either. So we're all going to have to step up and figure out how can we act responsibly at the same time we keep our businesses alive. Question 13, Kathleen, who is a licensed professional counselor. Is there anything in the works to bypass health insurance deductibles which create barriers to access services that people need? For example, mental health services, seeing a prescriber for medication. So my understanding right now is we have waived a lot of the reimbursement requirements or lack thereof for telehealth services for patients. We have basically, the federal government and CMS has said to the states, you have maximum flexibility to implement telehealth. Our hospitals, having talked to all of them in the last 24 hours, are trying as hard as possible to implement telehealth, again, because we want people to be able to shelter in place if they're symptomatic, part of a vulnerable population, and not have to drive to the emergency room and potentially infect a lot of other people right away. So that is the direction we're going overall. Whether that applies right now to the specific mental health services or prescriptions that you mentioned in your question, I will have to get you a specific answer to that. I believe we have loosened the barriers to accessing those services, but I don't want to say something glib without a precise answer, because we have loosened the barriers to everything in the last 72 hours, and they've invoked a lot of arcane emergency orders and the Defense Production Act and things like that. So it's a very rapidly moving target right now. But I'm asking, I'll ask my team to get a full answer to you, Kathleen, and work with Jamie to get that as well. Mike from Bad Badger Sports Bar. States have shut down hospitality businesses. What steps can be taken to keep suppliers from charging closed businesses for services that aren't being used? Examples would be Spectrum, DirecTV, trash and recycling pickup. Great question. Outside of canceling those services yourself, uncertain of legislative fixes. I'm uncertain of the specific legislative fixes to that. What we have to do, again, is provide support to small businesses like those in the hospitality area that are shouldering a lot of the costs. There are some provisions we're working on right now to relax the requirement for tenants to pay their rent every month without putting every real estate person out of business. But there's got to be a way where we relax that and assure that people eventually get the money that is owed to them without forcing you to pay when you ask the government is forcing you not to have any customers right now. So I'd love to work with you, Mike, on what that looks like in a common sense way. I would also say you're right in that population, in a sports bar where you're probably getting hit the hardest right now, because people are being told, don't go out, don't go to the bars, don't go to the restaurants. And, we need to make sure that you don't go out of business, both at the state level and at the federal level, if indeed we're going to shut you down. Erica from Lamers Bus Line. One area of business that has been unfortunately ignored is the school bus and motor coach companies. Our industry isn't getting as much publicity as airlines, hotels, restaurants, while we've been just as impacted as those industries. What can be done to ease companies like ours through this significant turmoil? Great question. As we touched on earlier, no industry is safe from coronavirus, and therefore a stimulus that only prioritizes certain high-profile industries and ignores the smaller guys that are being impacted is going to be misguided. And again, I think we have to look at the industries that were especially or uniquely hard hit. I would say right now, if we can get the healthcare crisis under control, we can find a way, if we do that rapidly as possible, to ensure that we're not trapped in a shutdown for another month and make you whole and anyone else that has been uniquely affected by this. So again, we have to apply the Hippocratic Oath and make sure that first we do no harm. That being said, if you have creative proposals that affect your industry, this is a fast-moving target. The Senate is actively debating right now. It is unclear whether we will be able or when we'll be called back into the House and whether we'll be allowed to submit amendments to anything that we're debating on in the House. But certainly, I am going to tee up as many amendments as possible for things exactly like this and would love to work with you on what that looks like to make sure that we craft it in a way that alleviates your concerns. So with that, I think we have 10 more minutes, and I will turn it over to Jamie for any questions that we missed.
Yeah, we have a few questions that came in while you were giving your update. The first is from Robert from a surveying company. Will the federal government be making changes to ensure that similar situations don't occur in the future?
We have to. I think when the dust settles, there's a series of broader questions that we have to answer. The most obvious in my mind is how critically and dangerously dependent we are on China for everything right now. The reason there are certain medical devices, there are pharmaceuticals that are made in China that we are entirely dependent on right now. Even some of the promising treatments that are being talked about, like the drug that Gilead is developing right now, components of that drug are made in China. And China, party officials are actively threatening to shut down their exports and, quote, plunge America into the sea of coronavirus. And so we are going to have to, and this will not be something that can happen overnight. It'll be the work of a decade. We're going to have to rebalance our supply chains and bring a lot of that manufacturing either back home here domestically or at least to countries within the free world that we trust. And I think the message that we need to send to China and anyone else right now is that if you stop shipping something in the midst of this crisis, you will not be allowed to sell that product to America going forward. I've already introduced a bill to that effect with Senator Tom Cotton related to pharmaceuticals, but it goes much broader than just pharmaceuticals. It affects the future of the internet, 5G internet, telecommunication. We have become so dangerously dependent on China for everything. The second big lesson that I think it's fair to take away already, even though we're in the midst of this crisis, is how dependent all of our states have become on a federal infrastructure, emergency management infrastructure, that simply has not been able to act quick enough to get the states the resources they need. So, for example, I mentioned testing earlier. Our hospitals in Northeast Wisconsin are ramping up their testing already right now. They're doing the right thing. But the reason we stopped doing the drive-through testing is because there is a critical lack of certain components like swabs and reagents, and the state is left in the position where they basically have to beg FEMA and the CDC for more supplies of reagent. And in cases where hospitals have asked certain private companies to produce more of that, the CDC has swooped in and diverted it to other areas that are higher priority. That is unacceptable. We need to have the resilience at a state level to take care of our system and our people in a way where we're not left waiting for help from the federal government. So I do think there's going to have to be a way where we take a look at our entire disaster response effort and figure out how can we build more resilience into the system at the local level, at the state level, and at the federal level. Because it's clear to me, if you just look at the whole testing debacle from the start, it did not work as it was intended. There was too many individual areas where certain people could veto. We're trying to ramp up production. We're loosening, the regulatory, the FDA's role in that right now, but it's just not happening as fast as we need it. And then third, I do think we need to, and I just spent the last year chairing a commission on U.S. cyber policy. We just released our final report last week. And our intent with that was to try and be the 9/11 commission prior to 9/11, make sure we could avoid the next cyber 9/11. And the haunting phrase from the 9/11 commission report, if you remember it, is that ultimately 9/11 was a failure of imagination. We never took the time to step back and plan for something this unthinkable. And I think the same is true here. It never occurred to us that something, I think it's more fair to say that there were experts that were warning about, another influenza-like pandemic, some of the dangers we're seeing coming from China and things like that. But yet it never captured our imagination such that we did the planning on the front end to be ready for this moment. Similarly, we need to start doing the planning right now for a massive cyber attack combined with another pandemic so that we're not making these decisions about how do we restart our economy while balancing public health concerns on the fly. We've already done the war games to prepare for it, and we already have the infrastructure in place because I just think there are multiple ways in which this has revealed single points of failure in our system and a lack of resiliency built into our overall system.
Brian from Tundraland asked a question. After the 2008 collapse, certain regulations were put on banks for stress testing their balance sheets. The biggest risk for liquidity challenge is that exact regulation. Are there plans to correct that regulation?
So could you read that last part again? You broke up.
The biggest risk for a liquidity challenge is that exact regulation. So the regulation that banks have to stress test their balance sheets. Are there plans to correct that regulation?
Well, I guess I see it in a much more simple fashion. I think the biggest mistake that we made after the 2008 crisis and with Dodd-Frank is that we didn't just have a simple capital requirement for the bigger banks, and certainly one that adjusted for the inherent tax we place on our small and our medium-sized banks. And that's why I earlier mentioned the need to provide for the FDIC to provide unlimited insurance for transactions and deposits, because that gets at the implicit subsidy that we give to the money market accounts and the big banks at the expense of our smaller banks and our community lenders. So I actually think, to the extent we learn another lesson from this, is that we just need a simple, across-the-board capital requirement that doesn't allow the big banks, who are quote-unquote systemically important, to have an advantage over our small and our medium-sized banks. That's one of many things we can do to rectify this once we get out of the crisis.
One of your constituents asked, when are employees of businesses closed for the virus eligible for unemployment insurance?
You still will be eligible for all state unemployment insurance, and certainly the intent of the bill that was passed in the House was to make sure that there was a no job loss provision for any employee that has to go home on sick leave in the bill. But certainly any existing state program would not be affected. Indeed, the proposal we were discussing with Senator Johnson was how could the federal government plus up and backstop existing state unemployment and unemployment insurance provisions.
Michelle from Care Patrol Fox Cities, her question was, the payroll tax reduction would have helped me to continue to pay my employees longer despite falling revenue. Why focus on cash payments for those not working? Isn't it better to keep those who are able, productive, and ready to go once the crisis has passed?
I think that's a fair point. I don't see any objection to that argument. I would say, indeed, our last tax law change, we eliminated, I mean, this is sort of an orthogonal or related point, the carryback current law provision, the current losses to past year's tax payment by more than 1 year. So you could imagine a scenario in which we allowed carryback losses up to 5 years so they can then get a refund for past year's paid taxes so we can survive. That's one thing you could do. But as I understand it, the original bill didn't have any payroll tax holiday. So that was one of the many reasons why. Now, Secretary Mnuchin is talking about doing that through executive fiat. There were changes at the last second, but it's one of the many reasons why it's putting a burden on smaller businesses without actually giving them what they need to keep their employees employed and get them back to work as soon as possible. So I actually think you raise a very fair point.
Andy from Vanderloop Shoes asks, will there be protections for small businesses and the loss of income they are currently going through? Getting money into the hands of employees is extremely important, but having a company for the employees to come back once this passes will be equally important.
100% agree. There was an expansion of small business loans, not in this bill, but in the previous $8.3 billion package that we passed and I supported in the House. Any stimulus, and even the draft stimulus bill that McConnell released last night, does include a variety of provisions that would at least be intended to provide support to small business. There is, I think, further an effort to allow insurance claims for small businesses for the government to suspend SBA payments for 90 to 120 days. We've already reached out to the Senate Banking Committee to make sure they're aware of that change. So just as we're sort of doing things like deferring tax payments for a few weeks, you could imagine allowing small businesses to defer their payments to the Small Business Administration for 90 to 120 days while they weather the crisis. And the whole goal here is to not create a cash crunch for that small business who all of a sudden has been asked to shut down and then shoulder the burden of paying all their employees while they may not have enough cash to do it.
And the last question is regarding the effective date of the legislation, which I believe is April 2nd. What happens if the state of Wisconsin declares a shelter in place prior to April 2nd? Will the provisions of that bill, will these provisions be available for businesses if we do shelter in place prior to its effective date?
Yes, with a big caveat, and this gets to, I think, what's the primary flaw in reasoning. And again, I say this as someone who's taken hours to try and understand the provisions, and not a lot of other people have done it right now. And we're still getting conflicting messages from the Treasury. Yes, but if you can't survive until April 2nd, if you have to shut down because you don't have enough cash, and there are businesses right now, every second in Northeast Wisconsin, that are having to fire people because of the shutdown, then your employees can't come to you starting on April 2nd for payment, right? Because they're no longer your employees. And in some cases, your business may no longer exist come April 2nd. So in other words, we have this decisive window in which we are asking Americans, Wisconsinites, to do something very drastic and to shoulder a lot of burdens for the public good. Got it. We all want to be disciplined. We all want to do what's right here. But if in that window we don't get the money and the resources to those very people that are shouldering the burden, then their business is not going to exist on the other side of the window. So my initial reading of the legislation, and I'm happy to be proven wrong, is that while the provisions will exist post April 2nd and your employees can get the benefit of them, if you shut down prior to that and if you have to fire people, they will not get any benefit from paid sick leave or paid family leave because they will no longer be employees.
Excellent. So that is all of our questions, and it looks like we're also out of time. So Congressman Gallagher, thank you so much for your time and your leadership on this Thank you for explaining and answering all our questions. And please keep us in the loop as things change. And so happy to partner with you and our other business organizations friends to get some more information out to our business members in Northeast Wisconsin. So thank you so much. And thank you, everyone, for joining the call.
Thank you.